And we are live. Welcome, welcome. My name is Dr. Sarah Merritt. I'm the lead physician at Lifestream Health Center. We're located in Bowie, Maryland, and we're looking to make pain management more caring and accessible, patient-centric, and evidence-based. I'm here on our Facebook page, on our YouTube channel, doing a live broadcast with Dr. Tamara Beckford, who is a friend and colleague of mine. Welcome, Dr. Beckford.
Hi, thank you so much for having me. Hello to all of your listeners and your viewers. I am excited to be here and excited for this wonderful conversation. I think that we're really about to go into.
Thank you. So Dr. Beckford
Mhm.
is a emergency doctor, and she, in case you don't know, emergency room doctors work kind of wild hours. Sometimes they work nights,
Mhm.
they work 24-hour shifts. Um, and this is the type of thing that can really set up doctors, people, humans, anybody,
Mhm.
to not feel good.
Absolutely.
And what is being experienced at record levels, and we're calling it often burnout when we have certain feelings. I guess, Dr. Beckford, I've heard some different definitions of burnout, and I think
Mhm.
it's salient for my patients to talk
Right.
about that because I treat people with chronic pain, and they
Mhm.
might be burned out with their own life situations. But I know you kind of deal with burnout maybe in the workplace, but share with us like what you can about what burnout is.
Absolutely. So, the true definition of burnout is a physiological response to chronic workplace stress.
Mhm.
So, that is in its truest form what burnout is. And if we really think about it, a lot of times we hear the word burnout and we're wondering, like, well, am I burnt out? Am I just tired? Is just a fatigue? Is this just a phase? And the word phase is actually quite important because that's what burnout is. There are phases to it. And there are actually 5 phases of burnout, to
Okay.
believe it or not. Yeah, it's not something that just comes on and off. And one of the difference that I'll say between burnout and when you're just tired, when
Mhm.
you get a rest, we've all had those periods of time, right? When you just had a few weeks that was just like, whoa, this was just a really trying week. You
Yeah.
get a weekend away with your friends, your family, and you get recharged and you go back and you're feeling great.
Mhm.
With burnout, that weekend is not enough
Yeah.
to make you feel great because, as we said, it's a physiological response to chronic workplace stress. So, really, the 5 phases of burnout, the first phase is called the honeymoon phase.
Yeah.
And within that phase, you are feeling enthused, you are feeling that you're making an impact. The
Mhm.
work that you're doing is going to leave a lasting impact. You just feel energized at your
Mhm.
job and your workplace. And then there's the onset of stress. And with that, you're starting to feel a little bit of change in the way that you're managing your work. And this sometimes can be due to pressures that either can be internal
Mhm.
pressures where we know some of us are very like type A and we go in and we're going to change the world in 25 minutes,
Yeah.
or external pressures where you are feeling as if you're unable to handle some of the workload that's coming on.
Mhm.
You move on to phase 3, which is now chronic stress, right? So now you have the acute phase, the acute stressors, and now you're on the chronic. With
Okay.
the chronic, you start to have, which is what some of what you help to treat with, are some of the psychosomatic symptoms,
Yes.
where you'll have patients who are having headaches or they're having body pain, they're having gut issues.
Yeah.
However, you've done all the testing, the patients have gone to all the specialists and they're not finding an answer.
Mhm.
And because some of those answers are just, it's a psychosomatic because it's related to stress versus related to a one particular thing. So it's not, the headache is not just a migraine. The headache is not because there's a tumor. The headache is related to the physiological psychosomatic response, like we're saying. And then when you get to true burnout, that is considered phase 4. So
Mhm.
burnout, the true portion, is, I like to call it the 3 Ds. And I
Mhm.
got that from Sesame Street.
Mhm.
How else can one how else can one remember things other than how Sesame Street helps us?
Uh-huh.
Right? So the first D is depletion. So
Okay.
that's when you're emotionally exhausted. So you're just depleted. The
Mhm.
second D is detachment. So with detachment, you start to depersonalize things. So you become cynical.
Yes.
And yeah, you start to say, it is what it is, whatever. You start to just depersonalize yourself from the work. And then the third D is a decreased sense of accomplishment
Mm.
in your work. So, whatever it is that you're doing, the impact that you felt in the honeymoon phase, that you're making this great impact, you've lost that.
Mm.
So you've lost that impact. Even if you are making an impact, you internally do not feel that effect. And then the fifth phase of the phases of burnout is the crisis phase. And
Mm.
that's the phase that we don't want to get into, because that phase is likened, it's kind of almost like a bridge to the mental illness, where it's like a bridge where you're having some of the symptoms that are similar to anxiety and or depression. So you're having like some of the hopelessness or the helplessness um, feelings or sensations. So that those are the 5 phases of burnout, and incorporated in that were my 3 Ds, which is the true definition of 3 Ds that one has with burnout. And as we said, when this happens, you at times will have some of the symptoms that you, Dr. Merritt, and your team will treat, which are some of the pain and some of these chronic pain symptoms that can manifest themselves in those who are going through that.
For sure. And I know
Mhm.
you've worked a lot with healthcare workers and employers.
Mhm.
But I mean, I suppose people can get burned out just in those caregiver roles at home or
Absolutely. Yeah.
with certain relationships or things like that.
Mhm. Mhm. And it's interesting because right now with the World Health Organization, they're kind of in between trying to determine, like, is this a mental illness? Is this
Mm.
so right now they haven't truly added it to one the spectrums of mental illness, but it's kind of pretty close. You know what I mean? So right now they're just really having it as just a syndrome, like, so it's not there. But as you mentioned, for those who are in roles such as caregivers roles,
Yeah.
you can hear when I talk about the 3 Ds of burnout, you can see how at times that will affect you and how you might feel that way. The
Yeah.
depletion, I mean, you're taking care of someone over and over and over, and you're exhausted. You
Yes.
yourself are not getting any rest. And it's not that you don't care for this person, especially if it's a family member that you yourself are the primary caregiver of that family member. I've seen families who are taking care of loved ones where the loved ones doesn't have a good sleep pattern,
Mhm.
and that the loved one needs to be monitored in case one of their machines malfunctions, because if a machine malfunctions, then some dire thing might happen within a certain period of time. You can see how that caregiver is always on edge. You
Yes.
hear a beep here or there. You try to take a rest, but are you truly getting, like our colleague Dr. Funke would say, are you truly getting restful sleep
Mhm.
during that
Mhm.
time, when you're sleeping, but you're not getting that true rest, which we know is also a part. So you can see how you can get depleted,
Yeah.
exhausted. You can see how can become a little bit cynical with the world. No one else can do it like I do. And you can see also, you are you can get depersonalized, and you can see that your decreased sense of accomplishment in your work. Like, everyone's like, oh, you're doing such a great job. And you're like, yeah,
Right.
yeah, yeah.
And I suppose we can move maybe in and out, maybe there is some
Oh,
some
yeah.
fluctuation or some movement up and down this spectrum or these 5
Yeah,
sort of stages, so to speak, of burnout, and maybe we
absolutely.
we would try to live in the honeymoon phase where everything's great and feel fantastic. But the fact is, most of us don't feel fantastic every single day, all the time.
Correct.
But if we have skills, maybe that can
Mhm.
help us, to ground ourselves and move back toward that phase, I think
Mhm.
that can be really impactful.
Absolutely. And it's so important to recognize that you're right, that we don't stay in one phase all the time because we're humans and we're dynamic beings. So being able to move from one phase to the other, the goal of what I do is to really to move people from the latter phase back up as close to the honeymoon phase as possible. And as you said, some of this is with some tools. And some of these tools are small but powerful tools, right? So one of the tools that one can use is I have this thing called like pause technique that I teach,
Okay.
and the pause technique, it can be used during periods of high level of acute stress when you
Hmm.
have 5 minutes that you want to just bring that stress level down. And it's something that I came up with a couple years ago, and I've been able to teach it to a few people. And it's something like this. So the P for pause is for you to literally pause. So we're
Okay.
in a period of an acute stress, and we are going to just pause. A is acknowledging that stressor. What is causing the acute stress at this moment in time? So it could be a deadline that's coming up, something that got thrown upon you unexpectedly um, that has like an approaching deadline, and it just threw your whole day for a whirlwind, right? You're
Hmm.
acknowledging that.
Hmm.
You is for understanding how that stressor affects you. So you're going to understand, okay, this is how I'm feeling, and you're going to acknowledge and understand this feeling. This is causing me to feel anxious. And because I'm now anxious, I can feel my heart racing and I'm having palpitations. Or I notice that I'm not taking deep breaths, or I'm feeling agitated. So you is understanding how the stressor affects you. S is setting a self care goal. So you're going to use some self care techniques. Some of the techniques incorporate things like, okay, I'm going to take a quick walk and remove myself from this physical location and go outside. Or I'm going to do a quick breathing exercise. Or a self care quick technique could say, all right, you know what? Whenever I listen to this song, it always puts me in a great mood. So I'm going to
Hmm.
put this song on. It's
Yeah.
only a 2 minute song. I'll listen to it for 2 minutes and I'll change my mood, right?
Yeah.
And E is executing. So you're saying, I'm going to do all this, but then you just immediately execute it. And that's just a quick 5 minutes and you change the whole tone. And it's a quick way to just reduce your stressors. So that's the pause technique.
That's awesome. I love it.
Mhm.
E equals execute it. Awesome.
Yes.
Um,
Mhm.
Very good. And tell me about like a way that you've used this or a time that you've used the pause technique where it's made a difference or a client or
Oh yeah.
hear
So
about.
this is a technique that I've taught in a couple different settings.
Mhm.
So for those who are in the legal fields, so some of our lawyers out there who are listening and have had a day where it's just getting busier and busier and you're being given more and more and more tasks, or you felt as if you were in control. All of us have had those days that we felt, "Ah, yes, everything is in control," and then one thing just happens, boom, and then it just turns into a whirlwind. So that's when we use the pause technique to really to gain that control. Because when we think about all burnout in its core, it's really a loss of control.
Yeah.
you
Okay.
know so when we do and incorporate some of these techniques, we're trying to pull back and trying to harness some of that control.
Hmm.
Other settings that I've been able to use this, of course, in our healthcare, in our field itself.
Yeah.
As you mentioned, I am an emergency medicine physician,
Hmm.
and one of the things that people have often said is, like, "Are you so calm?"
Hmm.
Because I feel as if when I'm stay calm, I can help to hold on to some of that control helped me to think logically and make the decisions that I need to make in those snap moments.
That's right.
In addition to like losing control that happens with burnout, part of it is losing control of that portion of our brain, which is like the frontal lobe where our executive function exists. So the chronic stress affects that portion of our brain. So when I stay in that mode where I stay as calm as possible, I
Mm,
am able to hold on to some of that control so that I can use that executive portion to make the decisions that I need to make in those snap moments.
yeah, and the pause gives you that separation where
Yes,
you are able to use those, better judgment parts of the brain.
correct. When that reptilian portion is ready to go in and your primitive part of the brain is ready to take
Mhm.
over, you just pause
Yeah,
and you take
yeah.
it back in control and get that executive portion working.
No, I think that's so important.
Mhm.
And I think the process of burnout can be sort of insidious, can't it? I mean, I think you're the expert in this area, but my
Mhm.
what I've seen, and what
Mhm.
I've even experienced, you might think that you're fine, and then suddenly
You're
you
not.
feeling or you say something and you're like, oh, I didn't know that's where my brain was.
Yes, absolutely. I remember on one of the books that I've been able to write a chapter on burnout with
Mhm.
some of our other physician colleagues. I likened burnout to a tiger that's
Okay.
crawling through the tall grass,
Hmm.
where you've seen any of you might not have seen a tiger, but you've seen your cat when they're ready to
Hmm. Okay.
pounce and
Hmm.
they're walking through the grass and then they keep their eye on that target, but they're sneaking and they're
Hmm.
doing it slowly and then they just pounce. I feel like that's a liken to how burnout is, in that it slowly brings itself on.
Hmm.
You might not recognize some of the symptoms, especially if you're not attuned to it.
Hmm.
And when it grasps you, you said that's when you start looking and you recognize that I am thinking the ways that I don't normally think. I am
Hmm.
in a zone of negativity when this is not my baseline.
Yeah.
And that's one of the things that burnout does. It makes you have this myopic view of life. And the way that you're viewing it is not through the lens of gratitude and, that harmonious view where sometimes I'll have good days and sometimes I'll have bad days, but my good days outweigh my bad days, right?
Right.
It's, I'm looking at the life through the lens that things are negative and therefore everyone is attacking and
Hmm.
I'm going to look for anything that is going to attack and I don't see positivity. So you're
Yeah.
looking through life through a lens of negativity. So once you start to recognize some of those insidious symptoms,
Hmm.
then you need to take a pause, another version of a pause, and look and try to figure out, why am I feeling this way?
Hmm.
Why am I having these symptoms? Why am I looking at life through these lens? What is it that I can do to offset my mind?
Hmm.
And to offset things that needs to occur so that I can get back to how I know the person inside of me, the true person is. And sometimes that could really be that you've overloaded yourself with tasks.
Hmm.
And some of these tasks are tasks that needs to be delegated.
Hmm.
And
Hmm.
that's when one can do a simple exercise by writing down all the things that you're doing in a week
Yeah.
and delegating. Who are you doing it with? How are you feeling? Just acknowledging,
Oh.
scale of 0 to 10. How am I feeling during that time? Is it draining my energy? Am I frustrated? Or am I energized and happy?
Hmm. Hmm.
Listing it. And then those that, if you notice that when you're with a certain person and you're doing certain tasks, that you're going closer to the 0 portion of the scale, which is
Hmm.
de-energized and frustrated, then that's time to make some decisions.
Right. And so
Mhm.
if we were talking about, a job situation or a relationship situation, you might think about
Like,
changing it if possible. Yeah.
yeah, change in tasks, seeing are there things that you can delegate.
Mhm.
um, Rest assured that it might not be that, okay, I'm just going to leave this job if you don't have that options, but are there
Right.
portions of the job that you might be able to delegate, or see if you can move to a different part of the same company, or
Mhm.
see the tasks that are listed. Are
Mhm.
you stronger in certain portions than you aren't, and you can bring that up, like, hey, this is where my zone of genius is. Maybe your employer doesn't realize that.
Yeah. Yeah. That's super interesting.
Hmm.
I want to ask a question around. I was intrigued when you were speaking about the, person realizing maybe you're having an insight to feeling a negative perspective, right? And
Hmm.
realizing that they're coming at things with a negative perspective. And
Hmm.
and I think one of the challenges that I have at times with patients and some interactions is that, and oh gosh, and even with my kids, like sometimes people
Yeah.
just don't even realize that they have a negative perspective because their
Hmm.
perspective is their perspective. And well, this is just how it is. This isn't
Mm.
negative perspective. This is just
Mhm.
how it is.
Yes.
How have you ever been able to connect with someone through that? Or are there ways that we can approach, and maybe
Hmm.
gently in those scenarios? Because I've certainly met with that, even this week where a patient or a kid, might not even realize
Hmm.
where they are with their perspective.
Absolutely. That's a great question. And it's so poignant because when we think about our thoughts throughout the day, we have almost like 70,000 thoughts, and
Mhm.
almost 70% of them are just negative. So we're really
Is that
overcoming a
right? I
lot of
haven't heard that
negative. Yeah, we're really trying to overcome a lot of negative thoughts on a
What? Okay.
daily basis. Yeah. So I would approach it from an area of curiosity, which I think you're very, very good at, Dr. Merritt. I've known you, and I've known each other for many years, and
Yes.
that's when I think of one of your strengths, where you approach things from an area of curiosity.
Mhm.
And with those scenarios, I would approach it from curiosity too. So, oh, interesting. What is it that makes you like say that? And then
Mhm.
hearing, because the view, we all see life through our own lens,
Mhm.
and a lot of times we are our lens is based on our experiences, our environment, and really where we would hope to be, but we probably haven't achieved. So almost as if there's that gap from where you would like to be.
Yeah, where I am
But
to where I wanna be.
from where I am to where I want to be.
Mhm.
However, there are many people who have worked on that, such as you and I. We have a lot of our colleagues and friends who have done that, where we've worked on that portion where we've recognized, yeah, there's some limitations, but limitations, a lot of it is in our minds, and we
Mhm.
can work on our minds as to where that gap is and narrow that gap because we've built that inner strength.
Mhm.
Those who haven't, they find it hard to
Yeah.
see life from that perspective.
Yes.
So when we approach with an area of curiosity, and then hear their perspective and why they feel that way and why their gap is so
Mhm.
widened, then we can interject with small little skill set that we've learned
Mhm.
that's helped. But we also have to recognize that we've learned those skill set over a period of time, right? Maybe it took
Yeah.
years to get
Yes.
it. That person won't get it in just our 20
Right.
minute or 30-minute conversation.
Mhm.
But you can instill them with just one portion of the skill set. Things that we've like for us, we've worked on a lot of our mental and our mindset, and the negative view that our mind has, which we call, like, some of it the sabotage or the
Right.
judge or the
Right.
soundtrack that plays in
Right.
our mind. So if we can instill within those whom we're having our encounters, just a smidget of, hey, well, have you thought about looking at it this way?
Mhm.
Or you can say to them, each time you're feeling that way, make a mental note.
Yeah. Yeah, I like it. Yeah, because
Mhm.
I would say, some of the tougher, cases and
Mhm.
moments, I've had with a patient who might have legitimate hey, I have a severe chronic pain problem. I can't
Mhm.
see a way out of it.
Mhm.
The medical establishment isn't giving me adequate solutions.
Right.
And it's a challenging thing to respond to. So I'm curious
Mhm.
about your perspective there, because for sure, on the one hand, I certainly have had those interactions and work to,
Yes.
try to help someone see if there's a different way to frame their
Mhm.
experience.
Mhm.
But I like what you said about really just asking questions and maybe um, approaching with curiosity and see if there's another perspective to be found that way.
Yeah, I've had some of our patients also in the emergency from the emergency
Mhm.
standpoint where they're coming into the emergency room for something, and I acknowledge I can see that this is frustrating
Yeah.
because you want an answer, but I know that I might not be able to be the one. So of course, and I know that you this is something that you do where I taper the expectation and said, okay, this is
Mhm.
my limitation.
Mhm.
However,
Mhm.
I want you to keep in mind that this might be a long road, but I don't want you to give up. There are people out there who will be able to help. I
Mhm.
might not be able to do it immediately, but
Yeah.
this is a first step. The
Yes.
next step will be blank. And that's from the emergent standpoint.
Mhm.
But for those who work with the chronic, patients who on a chronic basis, such as like with chronic
Mhm.
pain and so on, it's you're coming in from a different layer of frustration. Like mine is an acute frustration.
Mhm. Mhm.
That's what I see as an emergency physician.
Right.
And you'll see probably the chronic layer of frustration.
Mhm.
And at times the patient might not voice it, and
Yeah.
that's where coming from the approach from curiosity, where you can get, because once you get to that one layer that you can fix, then you're like, okay, well, the frustration is around this one, either not incident, but this one goal that they might have,
Yeah.
right? And so once you approach it from curiosity, you can find, well, I might not be able to fix everything, but I can help you with this
Yeah.
one area, and that might make a huge
That
difference.
might make a huge difference.
Hmm.
No, I love it. And I think some of it for dealing with burnout and some of these same feelings are,
Hmm.
feelings that my patients very commonly have who
Hmm.
experience chronic pain because they're burned out with dealing with their pain, right? Yeah.
Absolutely. Yeah. Yeah.
Like you're done with that. Um,
Hmm.
I really do like this pause technique as a moment to, acknowledge the stressors and
Hmm.
find a way to take care of yourself. Um, because I think fundamentally, and you said this too, there's maybe a gap in empowerment
Yes.
if we are burned out, if we are in chronic pain,
Hmm.
both. That is like not an empowered situation to be in.
Hmm.
And I think talking about how to take a pause, acknowledge what's going on, understand how it affects you, set a self-care goal, and then do something
Hmm.
worthwhile to nurture yourself can be so impactful. Thank you so much for that.
My pleasure. My pleasure.
Yeah, that's awesome. Um, well, I'm so glad that you've been here, Dr. Tamara Beckford. Um, what else should we talk about?
Well, I think I can give another quick tip, which
Mhm.
is writing down some of the list of things that do truly make you feel energized inside. So you
Mm.
can have a go to list.
Oh, I love it.
Um, this go to list can be used and incorporated with your pause technique.
Mhm.
Sometimes we get very down and we forget something such as the small gratitude. Um, it's hard to feel anxious and grateful at the same time.
Mhm.
So when we're deep within our feelings, we're going into deeper zone of negativity, and this can be challenging. I'm saying this,
Yeah,
but I'm not saying that this is
this is
easy. So
not
that
easy.
I do it. This is very hard.
Simple, not easy.
Simple, but not easy. It's starting to write down things that you're grateful for. And once you start having your list of your go-tos, I mentioned some of that could be breathing, it could be reading, it could be listening to your favorite song, your favorite audiobook, or just your go-tos.
Mm-hmm.
You use that list during the hard days.
Mm-hmm.
And to alter the mood, we know that our body really makes up of a lot of chemicals.
Right.
Let's just alter the chemical reaction that's going on to help to alter the mood, and to help you to move from one of those phases that we
Mhm.
talked about
Yeah,
emotionally to to the other, getting you back towards that left side of that phase diagram. That's the mental
fantastic.
diagram. Hmm.
Well, and I can say I've done some of this in the past myself, as far as like a gratitude journal,
Yes.
and it is very uplifting. And I've gone through times that I've tried to do it daily. I haven't
Hmm.
been perfectly consistent for sure, but just even getting at it,
Hmm.
for me, what was impactful was having a little notebook, having it in a
Hmm.
certain place, and
Hmm.
that part is set. And then at a certain time of day, for me, kind of end of day was a time to kind of reflect on some things, to be grateful for. Um, but if you kind of establish that habit, I think you could get at it certainly any time, especially if
Hmm.
you're going through a tough time where you really
Absolutely.
needed support, in the day, et cetera. Um,
Hmm.
and I would just add to that, actually, that in the scientific literature, there is some data that, um, and I think the gratitude journal studies that I'm aware of, they had people do this journaling first thing in the morning rather than,
Yes, I was going to say that's a part of the morning routine.
yeah,
Hmm.
that as a part of a morning routine journaling. And there were some studies where, it's like as impactful as an antidepressant medication, um,
Hmm.
or how much movement they got in the way people would score their own feelings and positivity and,
Yeah.
um, optimism, that a gratitude journal would be as powerful as a medication. I think that's really, really interesting.
Absolutely. And when we're talking about and that was going to be my next quick tip, would be a morning routine,
Mhm.
where even, and it goes to say, even adding gratitude into a morning routine. I think part of the power that it brings is that you are able to start your day off
Mhm.
being in charge,
Mhm.
right?
Mhm.
Once we get up in the morning, you're starting afresh, anew. You
Mhm.
get to choose the day that you want to have. How do you do that? You start by taking control from the onset. So, as you mentioned, writing down things that you're grateful for, you're
Mhm.
already releasing enough of these beautiful hormones that's letting you know that, okay, I'm in a great mood.
Mhm.
Other things that you do, which of course movement is another one that releases great hormones. um, I would implore people to not immediately interact with social media or
Mhm.
interact with your any form of your emails or anything that is out of your control that's coming
Mhm.
towards you, such as, like we said, your email, your social media. Do things that you have control over, that you know that you're pouring positive, uplifting, um, either phrases, sounds into yourself. So you start that way off. One way is for spirituality. For those who are spiritual, you could do something spiritual.
Mhm.
And these could be just for 5 minutes each. Writing into your journal for
Mhm.
5 minutes, a movement for 5 minutes, and listen to an affirmation or a podcast that infuses just positive and uplifting
Mhm.
sentiment. So that right there is only 20 minutes. And the last part you can do while you're brushing your teeth. you know so when you think about that, you've gotten up in the morning, you have not looked at social media, you haven't checked your email, you haven't done any of those things. All you've done is just poured into yourself. Once you've done that, you have built yourself up in such a way that now you can respond to the challenges of the day versus reacting
Mhm.
to them.
I like it.
So you'll read that email, and the email could have been a negative, interaction. You have not built yourself up, you're going to react to it
Yes.
immediately. Once you've built yourself up because you've put time into yourself, you'll respond to it. You'll respond to the email
Mhm.
appropriately, and then you'll move on with your day. When you haven't built it up, you react to the email emotionally,
Yes. Yes.
and you'll send an emotional response,
Mhm.
and you'll start to perseverate on that throughout the day.
Mhm.
Each time you'll start having these intrusive, I cannot believe that this person sent me this email.
Right. I'm still thinking about
I'm
it.
still thinking about it. It's 3 o'clock in the afternoon, and that I checked that email at 7:30 this morning. But
Mhm.
when you are building yourself up with the morning routines, and some of the examples are what we just mentioned, you
Mhm.
will respond, and then you control your day. I call that entering into your day and not letting your day enter into you.
Oh, I love
So
it.
that's a great way to do it with the morning routine.
Yeah. Starting it proactively, starting with your own
Absolutely.
choices, your own
Yes.
affirmations,
Gratitude,
gratitude,
movement.
movement.
Yeah. Some type of spirituality, something. Is it
Mhm.
yoga? Is it, a chant? Is it reading a spiritual thing like is your Bible, or any way that you've really just controlled the sentiment and the tone of your day?
Yeah. Absolutely.
Mhm.
Absolutely. That is gold and good stuff that I may shift a little how I think about it. I really like that. Starting your day with, um, pouring into yourself before you're going to even think about checking social media, think about
Mhm.
checking your email, et cetera. Because I think it's very easy to just wake up and like, okay, I'm going
Go.
to get started. Yeah, ready, go.
Mhm.
I slept as late as possible. Let me ready go. Um,
Yes,
but is that really
absolutely.
the best thing for us inside? And maybe
Mhm.
not.
Absolutely. Absolutely.
Yeah. Well, thank you, Dr. Tamara Beckford. I'm going to wrap us up here.
Mhm.
But I really appreciate your time. I really appreciate your expertise. Dr. Beckford, where can people find you online?
Oh, well, you can find me. I'm very active on LinkedIn. So
Mhm.
you can find me on LinkedIn. Just type in Tamara Beckford, MD. You'll see me there. Or you can find all things about me on my website, which is Your Curing Docs. That's URCaringDocs.com. With that, you'll be able to see my podcasts, newsletters, and all the additional things that's going on. If you'd also like to work with me, if you're looking for someone to speak at your next event on stress management, a dynamic speaker, stress management, burnout prevention for your next event, I'd love to be that person. You can send me an email at drbeckford@yourcaringdocs.com.
Wonderful. All right. Thank you
Mhm.
so much, Dr. Beckford. Thank you and have a great day from Lifestream Health. This is Dr. Sarah Merritt. We're located in Bowie, Maryland. You can reach
Mhm.
out to us by phone at 301-860-0305 or on our website. Find us online at lifestreamhealth.com.
Mhm.